The new LEAF concept with the idea of framing legal and medical issues around marijuana by itself and marijuana with opioids or other controlled substances is really a challenge. And you have to peel that apart and take the patient at face value, learn what you can about them, and then bring it all back together to try to decide what is the right treatment plan for this patient, what are the risks and benefits, what is going to keep them as safe as possible, and how do we monitor that and manage that all the way through the relationship. The law looks at that using some different language, but really this is more of a medical issue and proper management of the patient than it is a legal issue, but can it turn into a legal nightmare if it's not handled appropriately.
Well, from the clinical perspective of the new LEAF, what we were trying to bring to the audience is the notion that risk is not something you can eliminate, but risk is something you have to be cognizant of. If you don't look for it, that's your first deadly sin.
Right.
And the second one would be not writing it down, and the third would be not acting on it. This isn't just about the notion that in some states it's medically and recreationally allowed at the legal level, but yet at the federal level it's still illegal in a Schedule I drug, because that can become a red herring. It's a risk regardless. And from the perspective of managing risk, as you bring more complex pharmacotherapy to bear, you have to acknowledge that the reason you're doing it is because you haven't got optimum treatment with one option, and number two, you're using agents which intrinsically have their own risk and possibly greater risk when added together. So it's not that that's inappropriate, but failing to appreciate that is a deadly sin in medicine, and I suspect from defense perspective in the law.
Absolutely.
And I really think that the goal for us was to help people realize that a case that appears simple at one level may over time become more complicated, and you need a mechanism in place that helps you identify that risk change over time. Right. Risk is dynamic. You can make an assessment of risk according to various statistical tools, but we all know that that means if there are 100 patients exactly like you, a certain number of them will do one thing and a certain number of them will do another. Any one of those patients will do whatever that patient does. And it's really only by looking prospectively over time that we can get a sense of what's going on in that patient's life and how are they reacting to your behavior and your treatment plans. And you have to tighten your treatment plans. So the new LEAF was about saying, don't worry so much about the federal law, although it is in fact illegal. Worry about, are you appreciating the added risk? The fact that it's legal doesn't mean it's not risky. In fact, aspirin is legal and it's one of the most deadly drugs that's available over the counter. So simple availability and endorsement by the government doesn't change the fact that as clinicians we're obligated to serially assess risk.
I really think that from a make it visual perspective, there's no permission slip because of the legality of marijuana, medical or otherwise, in our country. There's no permission slip that it's okay to just go ahead and then continue prescribing the opioids. Whether, even with the marijuana not there, there's no permission slip that you continue to prescribe the opioids without managing or identifying and managing risks. And I would say to clinicians, you've got to decide what you want to look like if you end up on a courtroom wall. What does that relationship that you have with the patient look like? And it is going back to, these are opportunities to come back and really have good discussions with the patient and make it more about them and not about the number of pills and not about staying on a hamster mill and doing the same thing over and over again, but an opportunity to get back to that practitioner-patient relationship that has been just destroyed and torn apart by a lot of the focus on opioid therapy in our country. Get back to it, do what you're supposed to do as a clinician, document it, and make sure that you treat your patients as people and not just as a piece of paper.
We deliberately tried to explore the implications of one practitioner engaged in different substances compared to multiple practitioners engaged in different substances. And of course, the risk changes when the ability to communicate between the partners is adversely affected. And the fact that there's another person in the equation means that you may or may not be on the same page. And if you're not on the same page, you have to figure out how to get on the same page. Conflict between experts or between specialists, because most specialists are not experts. And I think that's an important point to make. We tend to think of the cardiac expert. He's not, he's a cardiac specialist. Or she's an endocrinologist, she's an endocrinology expert. They're different. They're trained differently, they think differently, and they're called on for different opinions. It's a shame that you have to put somebody on an opioid before you even think about urine drug testing. Because urine drug testing is a very simple tool that sometimes can just make a penny drop where otherwise confusion lay. It never made any sense until I did that urine and I found the cocaine. Oh, okay. Can we talk about that? It doesn't mean fire the patient. It doesn't mean terminate pharmacotherapy, but it doesn't mean ignore it. And if you get information like that and you do not show any evidence in the chart that you processed it and took it to the patient, what's going to happen?
Problems.
Big problems. That will show many different things, and none of them are good about the practitioner. It'll show they don't have a system to address laboratory evidence in a timely fashion. It'll show they're ordering without medical necessity. It could show a lot of different things. But in my mind, risk assessment is something you just do when substances that can cause problems are there. And if anyone's under any doubt that the fact that it's legal now, that it cannot cause problems for people, they really don't understand what marijuana is about.